I spent 12 years watching patients leave my office with a prescription in one hand and confusion in the other. They'd ask me, "Doctor, is this it? Is this all I can do?" And for a long time, the honest answer was uncomfortable, because the standard system wasn't giving them the full picture. My name is Dr. Walter Strong. I've spent over 2 decades in cardiology, working alongside cardiac surgeons, reviewing post-operative data, and sitting with patients whose blood pressure had quietly dismantled their health for years before anyone caught it. And what I'm about to share with you isn't a miracle cure. It's not a supplement. It isn't anything you have to buy. It's a 12-minute morning routine built entirely on peer-reviewed science, and it specifically targets the way blood pressure behaves in people over 50. So stay with me, because by the end of this, you're going to understand your own body at a level most people never reach. And that understanding is going to change what you do tomorrow morning. Let's start with the thing nobody explains properly. When a patient comes to me with a reading of 148/94, they want to know why. What's causing this? And the answer they get from most offices is salt, stress, and maybe some extra weight. Take this pill. Come back in 3 months. That's not wrong, but it's dangerously incomplete. Here's what's actually happening. Your arteries, the vessels that carry blood from your heart to every cell in your body, are not passive tubes. They're living tissue. They're made of smooth muscle and elastic fibers, and when you're younger, they behave like brand new silicone tubing, flexible, responsive. When your heart pumps, they expand to accommodate the pressure, then spring back. That elasticity is doing a tremendous amount of work to keep your numbers in a healthy range. But after decades, and especially after 50, something changes. The elastic fibers in your artery walls begin to stiffen. Collagen accumulates. The walls thicken slightly, and a stiffer artery is like a narrower pipe. The same amount of blood, driven by the same heartbeat, now generates significantly more pressure against the walls. That's arterial stiffness, and it is one of the primary drivers of elevated blood pressure in adults over 50. Not salt, not stress alone, the physical properties of the arteries themselves. Here's why this matters so much for what I'm about to show you. Most conventional treatments, including most medications, are designed to manage the pressure. They work on the number. Calcium channel blockers relax the muscles in vessel walls. ACE inhibitors reduce fluid volume. Beta blockers slow the heart rate. Each one is a tool aimed at a single target. None of them are specifically designed to restore elasticity to stiffened arterial walls. That's not a criticism of medication. Medication saves lives, and I will say that clearly and repeatedly. But if you want to address the underlying structural problem, you need something different. And that's where this protocol comes in. Let me tell you about a patient I'll call Marcus Webb. Marcus was 63 years old when he came to see me. He was already on 2 medications. His numbers were hovering around 151/96 despite full compliance with his prescriptions. He exercised, walked 4 days a week. He'd cut back on sodium. He was doing everything he'd been told, and he was frustrated in the way only someone who feels like they're failing despite trying their hardest can be frustrated. I introduced Marcus to the 3-component protocol I'm going to walk you through today. 6 weeks later, his reading was 124/81. He hadn't changed his medications. He hadn't overhauled his diet. He had added 12 minutes to his morning routine. That's it. I'm not telling you that to promise you the same result. Bodies are different. Baseline health is different. What I'm telling you is that this approach has a strong scientific basis, and that most people who apply it consistently see meaningful change. Let's get into it. The first component runs for 6 minutes, and it involves something called isometric exercise. Now, I want you to set aside whatever image that phrase just created in your mind, because isometric exercise looks like almost nothing. You're not running, you're not lifting, you're barely moving. But what's happening inside your body during these holds is extraordinary. In 2023, the British Journal of Sports Medicine published a large-scale analysis that examined over 200 studies looking at different types of physical exercise and their effects on blood pressure. The result was striking and, frankly, surprised many in my field. Isometric exercise, specifically wall sits and planks, produced the largest reductions in both systolic and diastolic blood pressure of any exercise modality tested. It outperformed aerobic cardio. It outperformed weight training. For adults over 50 with elevated readings, consistent isometric training reduced systolic pressure by an average of 8 to 10 points. To put that in context, many second-line blood pressure medications produce reductions in that same range. So why does holding still do this? Here's the mechanism, and it's worth understanding because once you see it, you'll never skip these 6 minutes again. When you hold a wall sit or a plank, your muscles contract hard and stay contracted. That sustained contraction temporarily compresses the blood vessels running through the working muscles. Blood flow is partially restricted. Then, the moment you release the hold, those vessels suddenly open. Blood floods back in rapidly. The vessel walls expand quickly and forcefully, and over time that repeated cycle, compress, release, expand, functions essentially as a training stimulus for the vessel walls themselves. They become more responsive, more elastic. The smooth muscle in your arterial walls learns to relax more efficiently. Think of it as physical therapy for your vascular system. Here's the protocol for these 6 minutes. You'll do a wall sit first. Slide your back down a flat wall until your thighs are parallel to the floor and hold that position for 2 minutes. During the entire hold, breathe normally. This is critical. In and out, slow and steady. If you find yourself holding your breath, you're working too hard. Reduce the angle slightly until you can breathe comfortably. After the wall sit, move to a forearm plank, elbows on the floor, body in a straight line, core gently engaged. And hold that for 2 minutes with the same steady breathing. Then return to a wall sit for the final 2 minutes. 6 minutes total. No equipment. No gym. You can do this in your bedroom, in your kitchen, in whatever you're wearing right now. If you're new to this, please start at 30 seconds per hold. Build up by 15 seconds each week. Your muscles will adapt. And if you feel any chest discomfort, dizziness, or unusual pain during these exercises, stop and consult your doctor before continuing. That's not a formality. That's real guidance. The second component takes 2 minutes, and it may be the most underestimated thing I ask my patients to do. It's a specific breathing pattern called resonance breathing. And I want to explain the science before I give you the steps, because the science is what makes this feel credible rather than trendy. Your autonomic nervous system runs everything you don't consciously control: your heart rate, your digestion, your immune response, and critically, the tension in your blood vessels. It operates in 2 opposing modes. The first is sympathetic activation, your fight or flight state. In this mode, your heart rate rises, your blood pressure climbs, and your vessels constrict. The second is parasympathetic activation, rest and recovery. Heart rate drops, blood pressure decreases, vessels relax and dilate. Most adults over 50 with chronically elevated blood pressure are spending too many hours in sympathetic mode. Not because of acute stress, but because of chronic low-grade activation, the ambient pressure of modern life, poor sleep, background anxiety, inflammatory diets. The nervous system gets stuck with its foot on the accelerator, and the blood pressure never fully drops, even at rest. The vagus nerve is the primary pathway of the parasympathetic system. It runs from your brainstem all the way down through your chest and into your abdomen, and it is directly involved in regulating heart rate and vascular tone. And here is the remarkable thing. You can deliberately activate the vagus nerve through your breathing pattern. You don't need equipment. You don't need training. You need a specific rhythm. Inhale through your nose for exactly 5 seconds. Exhale through your mouth for exactly 5 seconds. That gives you 6 breath cycles per minute. This specific frequency is called resonance frequency breathing, and it is not arbitrary. At 6 breaths per minute, your cardiovascular and respiratory systems enter a state of coherence. Your heart rate oscillations and your blood pressure oscillations synchronize with your breath in a way that maximally stimulates vagal activity. The brake system of your nervous system fires with full force. Vessels dilate. Heart rate slows. Blood pressure drops. Multiple randomized controlled trials have demonstrated that 8 weeks of daily resonance breathing practice produces sustained reductions in systolic blood pressure of 8 to 10 points. The effect is cumulative. It builds over time the way a physical training adaptation builds. And it doesn't require 8 weeks to start working. Most people feel the calming effect within the first 2 minutes of their first session. Sit upright in a chair, feet flat on the floor, hands resting comfortably on your thighs. Close your eyes. Set a timer for 2 minutes. Inhale through your nose, 5 seconds. Exhale through your mouth, 5 seconds. That's all. The sitting position matters. It keeps your diaphragm free and maximizes the depth of each breath. Don't do this lying down if you can help it. Don't check your phone. Don't open your eyes. Give it the full 2 minutes of undivided attention and let your nervous system do what it's designed to do when you stop overriding it. Now, here's what I want you to notice about the sequence. The 6 minutes of isometric exercise you just completed has already made your vessel walls more responsive and relaxed. Now the 2 minutes of breathing tells your entire nervous system to follow suit. The two components reinforce each other. That's not accidental. That's the whole design. The third and final component runs for 4 minutes, and it is, without question, the one that surprises people the most. You're going to drink water. Specifically, you're going to drink about 450 to 500 milliliters, roughly 16 ounces, of water. But not the way you normally drink it. Here's the connection that almost nobody makes. Dehydration raises blood pressure. When your body's fluid volume is too low, your blood becomes thicker, more concentrated. Your cardiovascular system compensates by narrowing blood vessels to maintain circulation to vital organs. Narrower vessels mean more pressure. The relationship is direct and well documented in the research literature. Now here's what makes this particularly relevant after 50. The thirst mechanism, the internal signal that tells you to drink, becomes less reliable as we age. Research has shown that older adults consistently underestimate their hydration needs and often reach clinical levels of mild dehydration without feeling thirsty. This means a large portion of adults over 50 are walking around in a state of chronic mild dehydration, not enough to feel sick, but enough to keep blood pressure slightly elevated around the clock. But, and this is the part that genuinely surprised me when I first encountered the research, it isn't just how much you drink, it's how you drink it. Rapid fluid intake, throwing back a full glass of water quickly, activates a mild sympathetic response. Your body interprets the sudden surge of fluid as something to manage urgently, and it responds with a brief stress signal. Small, slow sips spaced out over several minutes produce the opposite effect. Deliberate, calm sipping activates parasympathetic pathways, the same system you just engaged with the breathing exercise. It extends the calming window. It keeps your nervous system in recovery mode rather than pulling it back toward activation. So in these final 4 minutes, pour yourself approximately 16 ounces of water and sip it slowly. One small sip every 10 to 15 seconds. No rushing. Let it be a deliberate act. What you're doing is rehydrating your blood, reducing the viscosity that was contributing to vessel constriction, while simultaneously extending the parasympathetic state your breathing created. It's a cool down, a seal on the work you've already done. 12 minutes total. Isometric holds for 6, resonance breathing for 2, slow hydration for 4. 3 separate mechanisms of blood pressure elevation addressed in sequence in a single morning session. Let me address something directly because I think it matters. There is a version of this kind of content online that promises things it can't deliver. I've seen videos claiming to cure hypertension overnight. I've seen protocols that tell people to abandon their medications based on nothing more than testimonials and enthusiasm. That's not what this is. The research behind each component of this protocol is real, peer-reviewed, and appropriately referenced. And the clinical expectation is not a cure. It's a meaningful, measurable improvement in a chronic condition, achieved through consistent practice over weeks. If your blood pressure is severely elevated, above 160 systolic, this protocol is a complement to medical treatment, not a substitute. Please work with your doctor. Tell them you're adding these practices. Most physicians will welcome the conversation because lifestyle interventions with this level of evidence behind them are genuinely useful adjuncts to pharmacological management. What I'm offering you is not an alternative to medicine. It's an addition to everything medicine already offers you. Now let me walk you through the 5 mistakes I see most often, because they are what stand between most people and real results. The first is breath holding during the isometric exercises. This is the single most common error. When people focus hard on holding a wall sit, they instinctively hold their breath. But holding your breath during a sustained muscle contraction causes a sharp, temporary spike in blood pressure, the opposite of what we're trying to achieve. The mechanism only works if you breathe continuously throughout the hold. If you can't maintain relaxed breathing, the angle or duration is too challenging for your current level. Scale back and build gradually. The second mistake is rushing the breathing exercise. The 6 breaths per minute rhythm isn't approximate, it's specific. 5 seconds in, 5 seconds out. I've watched patients describe doing the exercise and then demonstrate something closer to 3 seconds in and 2 out. Eyes open, distracted, phone nearby. That's not resonance breathing. The vagal activation that produces the blood pressure reduction depends on that exact rhythm. Use a timer. Commit to it fully. 2 minutes of genuine practice beats 10 minutes of distracted approximation. The third mistake is gulping the water at the end. I understand the impulse. You've done the exercises, you've done the breathing. You feel like the hard part is over. But finishing a parasympathetic breathing session and then rapidly drinking a full glass of water in 10 seconds partially reverses the effect. The slow sipping is the mechanism. It's not a reward after the protocol. It's the third component of the protocol. The fourth mistake is starting too aggressively. Marcus, the patient I mentioned earlier, tried to go from no isometric exercise to 2-minute wall sits on his first day and nearly quit after 3 days of severe muscle soreness. He called my office ready to tell me the whole thing was a bad idea. 30 seconds is a legitimate, effective starting point. Build by 15 seconds per week. Your vascular adaptation happens regardless of the hold duration, as long as you're consistent. Patience here is not weakness, it's strategy. The fifth mistake is treating a missed day as a missed protocol. You will miss days. Travel, illness, early appointments, difficult mornings. Life happens. The research on habit formation is clear. A single missed session does not erase the physiological progress you've already made. Your arterial walls don't forget the training they've received. Your vagal tone doesn't reset to 0. The only real failure is deciding that a missed week means the entire practice is over. It doesn't. You start again the next morning. The chain of days begins again. Here's something I want you to understand about why these 3 components work so well together, because I think it reveals something important about how we've been approaching blood pressure management. Pharmaceutical companies invest enormous resources developing drugs that each address one mechanism of hypertension. 1. A calcium channel blocker targets vessel muscle tension. An ACE inhibitor targets fluid and salt regulation. A beta blocker targets heart rate. These are genuinely effective, often essential tools. But the prevailing assumption has been that lifestyle modifications are too modest, too slow, and too unreliable to be treated with the same specificity. So the standard lifestyle advice remains vague. Exercise more, eat less salt, reduce stress. This protocol does something different. It applies the same mechanistic thinking to lifestyle intervention that we apply to pharmacology. Isometric exercise targets arterial stiffness specifically. Resonance breathing targets autonomic dysregulation specifically. Slow hydration targets blood viscosity and parasympathetic extension specifically. 3 mechanisms, 3 targeted interventions, 12 minutes. And unlike medication, the effect compounds over time. Your arteries become more flexible week by week. Your vagal tone strengthens month by month. Your body becomes better at regulating its own pressure. I want to close with something that isn't about blood pressure at all. It's about what happens when you decide to take your health seriously at 50, 60, or 70. I've worked in cardiology long enough to see what happens when people don't. I've sat with families in waiting rooms after strokes. I've reviewed the charts of patients whose kidneys gave out after a decade of uncontrolled pressure. I've seen what silent, cumulative damage looks like when it finally isn't silent anymore. And I can tell you with certainty, the window in which intervention matters is not closed at 50. It's not closed at 60. The human body retains remarkable capacity to adapt and improve at any age when given the right signals. 12 minutes every morning is a small commitment, but the biology it sets in motion is not small. Consistent isometric training reshapes the structural properties of your blood vessels. Consistent resonance breathing rewires your autonomic nervous system toward better baseline regulation. Consistent hydration keeps your blood thin enough to move through your vessels without creating excess pressure. These are real changes, measurable changes, the kind that show up on a blood pressure cuff 6 weeks from now. Here's the full protocol one more time, laid out simply. The first 6 minutes are your isometric block. Wall sit for 2 minutes, breathing normally throughout. Plank for 2 minutes, core engaged, breathing throughout. Wall sit for a final 2 minutes. If you're just starting, do 30 seconds per hold and build from there. The next 2 minutes are your resonance breathing block. Sit upright, eyes closed, and breathe at 6 cycles per minute. 5 seconds in through your nose, 5 seconds out through your mouth. Let your nervous system do the rest. The final 4 minutes are your slow hydration block. 16 ounces of water, sipped deliberately. 1 small sip every 10 to 15 seconds. No rushing. Let it extend the calm. Stack this onto something you already do every morning. After your first cup of coffee, after you brush your teeth, after you feed the dog. Pick an anchor and let this protocol attach itself to it. After a few days, you won't need to remember to do it. The anchor triggers it automatically. Track your sessions on a simple paper calendar. The visual chain of completed days becomes its own motivation in a way that digital apps rarely replicate. Give it 6 weeks before you judge the results. Take your blood pressure before you start and write it down somewhere you won't lose it. Take it again at 3 weeks and at 6 weeks. Let the data tell you what's happening. And please, if you're on medication, have a conversation with your doctor before you make any changes to your treatment plan. Tell them what you're adding. Show them this research if you want to. A physician who is resistant to evidence-based lifestyle intervention is worth having a real conversation with. But in my experience, most doctors are genuinely glad when their patients take an active, informed role in their own health. You're not done improving. Your body isn't finished adapting. The question is just whether you're going to give it 12 minutes tomorrow morning to prove that.